So how can we make BBL surgery safe? Hey everyone, I'm Dr. BBT, and today I'm going to go over how I use ultrasound during BBL surgery to make sure to do the surgery safely. So right now I'm with my patient and we're putting the ultrasound probe on the buttock area, and some things I'll point out on the ultrasound. The top of the screen is the top of the skin, and as we go deeper or lower on the screen, you'll see the different parts of the tissues. You'll see some streaks of white lines here. This white line here represents the superficial fascia of the subcutaneous plane. And then when you go a little bit lower, you'll notice a different white line, and that streak represents the deeper fascia that envelops the gluteus maximus muscle. That's the area we want to avoid during fat injections during BBL surgery. Going deep to this fascia has been implicated and considered dangerous because fat injected in that area can travel to heart and lungs and cause problems. As we go out towards the outside of the hip region, towards the lateral portion of the buttock, we see that that middle line, that's the superficial fascia, is still there, and the layer of the muscle is right there also, and that's the area we want to avoid injections. When we do BBL surgery, we want to make sure we're above or superficial to that deep muscular fascia so that we're not having that risk of fat traveling to the heart and lungs. You can see here that's the superficial fascia, and that's above that is where the skin is. When we do fat injections, if you're too close to the skin, you're also at risk of developing lumps and bumps and nodules and things like that. The safest place to put it is above the muscle, but also we want to make sure we get a good aesthetic outcome. So we want to make sure we're deep to the superficial fascia, but superficial or above the muscular fascia. That way you get not only the best aesthetic outcome, but we're also doing this as safe as possible. When using the ultrasound, we can be very precise with the placement of the fat to make sure we're not going too deep. And we're also making sure we're not staying too superficial or too close to the skin to develop those lumps or bumps or anything like that. If you're interested in the BBL, call the office and we hope to see you soon.